everybody, and welcome to the Windward Comprehensive Health Center. This site serves as a pod in the COVID-19 vaccination effort. A pod, or POD, stands for Point of Dispensing. The Department of Health has opened up sites like this around the state where people can come when it's their turn to be vaccinated for COVID-19. The state's going to be opening up more pods, some of them larger in the coming weeks, and we thought it would be a good idea to let you know what to expect when it's your turn to be vaccinated. So let's mask up, go inside, and check it out. As soon as you arrive, you'll notice a team of clerical workers and medical professionals working in unison toward one goal.
To get shots in arms, make sure that people get vaccinated, and that we do it as efficiently as possible, following the priority list as much as we can.
Everyone coming for a vaccine will have their temperature taken. Then it's time to check in.
These vaccine clinics are appointment only. So most important is that you've already signed up online, you have your appointment, and you bring your photo ID with you when you come to the appointment. And if you're coming for your second dose, you bring your vaccine card as well.
You're okay after your first one?
Yeah, I had a little fatigue.
After checking in, you'll be asked a few questions to make sure you are medically cleared to be vaccinated.
Come with me.
You want to make sure that you have not had any severe allergic reactions to any injectable medication or vaccine.
This room is actually where the vaccines are administered. So we have nurses that are sitting at each of our desks administering it, and we also have nurses that are working on prepping the vaccine for the nurses to be ready.
The process is very simple. I went to the front desk, I had an appointment, signed in, filled out the pre-vaccination screening, which was about 5 questions, turned in the form, rolled up my sleeve, they gave me the shot, and came out here for 15 minutes.
After getting your shot, you'll be asked to stick around for at least 15 minutes. This is an extra precaution, just in case you're one of the few people who has an adverse reaction that requires medical attention.
It was okay. Just like for numbness, that's it. It's like a regular flu shot.
And then what we're going to do is we're going to monitor you for the next week.
Well, I chose to be vaccinated because, well, I'm concerned for my own health, but I'm also concerned for my family's health.
Is that a great feeling?
Yes, it is.
It's actually been a wonderful experience for us here because everyone's been so thankful that they're able to get the vaccine and thankful that they've been treated respectfully and carefully while they're here. So it's actually been really heartwarming.
The decision of whether or not to be vaccinated is a personal decision. It's a decision everyone's going to have to make for themselves. But we're hoping that once people find out just how safe and effective the vaccine that comes in these needles is, that people will elect to get vaccinated. They will be protecting themselves, their loved ones, their neighbors, Hawaii in general. The vaccine gives us tremendous hope. If we mask up, vaccinate, we're going to get through this together. Thanks so much for watching.